Hi, my name is Amy Black, and I am the Pathway 3 Clinical Internship Director. My job is to establish legal documents called affiliation agreements with hospitals and areas where our students in the United States live and help them navigate the Pathway 3 program. So what is the Pathway 3 and why would you choose that? Pathway 3 allows for both healthcare workers as well as non-healthcare workers. In my previous life, I was working in the field of finance. I like to say 18-year-old me went off to college and was not thinking about lactation. I don't know many of us that were. But the mother of three was fascinated by it and wanted a shift in careers. So many individuals come to this field from a multitude of work histories and need the Pathway 3 to become an IBCLC. I have had marketing executives, military spouses, women with PhDs in music theory, first grade teachers go through my program. Some individuals are in the healthcare industry and are recognized healthcare providers by the IBLCE, our governing body as IBCLCs, but have not worked long enough to go Pathway 1. I have had many new nurses and nursing students come through the Pathway 3. There are also recognized healthcare providers like speech pathologists or OTs that only work with grade school children, or RNs that work in med-surg or orthopedics and have breastfed their own children, but want to shift in gears in their own healthcare careers. Or the L&D NICU postpartum or PEDS nurse that is working with lactating families but would like a more direct mentor opportunity before coming in IBCLC. This is a picture of one of my students on her last day of her internship. She is now a practicing IBCLC. For the first part, we will talk about the requirements that must take place in the 5 years leading up to the submission date. For example, if I plan to take the spring exam, the submission deadline will be 4 to 5 months prior to the exam date. All of these requirements must happen in the 5 years leading up to the time you submit to take the exam and must be completed prior to the deadline. So let's look at point 1. You need a minimum of 90 lactation-specific education hours, and that must include 2 hours of WHO code education. The second point is you need 5 hours of communication education, preferably in lactation, but not required. Of note, both of these top two are offered by LER. The 5 hours of communication is offered in our LCTP course as well as our core course. For the third point, you need 500 hours of a directly supervised lactation hours with an IBCLC in good standing. So how do you know if an IBCLC is in good standing? Well, that takes us to point 4. You do need to submit a Pathway 3 verification and get an approval, which is good for 5 years, to the IBLCE. When you do that, you'll be sending in your chief mentor, and they will let you know whether you can go ahead and go forward with that. Of note with this, anytime you add another IBCLC to your plan, you must send that into the IBLCE and have approval given back to you before you can start any hours with that mentor. And the fifth point is you need to follow and adhere the Code of Professional Conduct for IBCLCs. This is found on the IBLCE website. For each of these 8 subjects, the Pathway 3 candidate must complete a minimum of 1 course in this subject and demonstrate a passing grade. The course has to be the equivalent of 1 academic credit session in length and be provided by an accredited institution of higher learning. So you can use this from previous college experience. For example, let's take biology. If you look in the IBLCE Health Science Guide, it says that if you took this course or coursework in zoology, cell biology, genetics, microbiology, to name a few, it will be accepted. The Health Science Guide is a 14-page document that does go into further depth with this. You can take these courses at your local universities, community colleges, and we have also partnered with Walden University to provide options to complete the college course requirements. For each of these 6 subjects, the Pathway 3 candidate can complete these courses by an institute of higher learning or through continuing education courses. Basic life support is different from CPR. BLS is for healthcare professionals and first responders. In the United States, you can look for this option through organizations like the American Heart Association or American Red Cross, in which you can input your zip code and they will show you options in your area. If you are overseas, look to see who offers BLS. It may be organizations like your local Red Cross or hospitals in your area that offer it. As for the remaining 5 courses, you can find these locally through organizations near you, or Lactation Education Resources has an option to take all 5 in our IBLCE additional general education package, or you can take them separately if you only need a few. A Pathway 3 candidate must have a Pathway 3 approved by the IBLCE prior to starting phases 2 or 3. In phase 1, these hours do not count toward the 500 hours required. I usually tell my students to budget for about 600 hours just so that they have a little bit of an idea of how long this may take. Observation of the IBCLC intern, as described above, must occur before the Pathway 3 applicant works directly with breastfeeding families. At the discretion of the mentor IBCLC, observation hours may be undertaken before the Pathway 3 plan is verified by the IBLCE. The IBCLC decides how many hours a Pathway 3 student needs an observation before moving to clinical hours. It is at their discretion. Phases 2 and 3 may be counted toward the required 500 hours of directly supervised clinical practice. Again, I want to stress this point. These phases may only start after the Pathway 3 plan is verified by the IBLCE. Actual practice by the Pathway 3 candidate is required in phases 2 and 3. So they should be doing the plan of care with the family. In phase 2, this means that the applicant provides the care with the IBCLC mentor either in the room directly observing as the care is being delivered by the applicant, or observing through use of secure technology platform which has synchronous two-way audio and visual communication. Through either form of observation, either in person or via observation using technology, the mentor is providing guidance and assistance to the intern. As for phase 3, the candidate should not be allowed to practice independently until the mentor or mentors, again, IBCLCs in good standing, have determined the candidate knows the limits of his or her knowledge and skill. Per the IBLCE, knowing when to ask for help is absolutely necessary to the candidate's demonstration of specialized knowledge required of IBCLCs. So as an IBCLC thinking of taking on a student or a student thinking of going Pathway 3, please make sure you are able to get the hours required as stated by the IBLCE. It should never be 500 hours of observation. IBCLCs work in various settings. From the community setting, look at public health clinics, community healthcare clinics, community services that help families in need. They work in private practices, seeing patients in home and in offices. They work in pediatric offices, either as RN IBCLCs, who always see the lactating families, or IBCLCs that are designated as the full-time IBCLC. From a hospital perspective, it may require a little more to become a Pathway 3 candidate in that setting. Most hospitals in the United States want a school to host the student. This means the school is preparing the student by ensuring they have a drug screen, background check, vaccines, flu shots, TB tests, basic life support, etc. They may have additional requirements the school may need to do as well. And the last option is milk banks. If there's a milk bank near you and IBCLC is on staff, you may consider reaching out to them to see if they would be willing to mentor you. I hope this YouTube video was informative. And here is a picture of 4 of my previous students on their last day of their Pathway 3 500 hours. We hope you can reach your own goal of becoming an IBCLC.